Earlier today, Press Secretary Psaki said that if state superintendents that violated the state mandate for mask mandates did not receive their salaries, as you indicated, that the federal government would intervene and pay those people. What do you make of that? What's your reaction? Do you think the federal government is perhaps intervening in Florida State's COVID policy?
I think that they really believe government should rule over the parents' decisions, and I think the parents' decisions in this regard should ultimately be what is done. The fact of the matter is the parents are in the best position to know what's best for their kids. You know, there was, I think Anthony Fauci was on a radio program yesterday. He said, we don't know if it's harmful. We haven't studied it. We hope it's not. Well, there's a lot of parents that don't want their young kids to necessarily be sitting there for 8 hours, particularly the kindergartners, the first graders, the second graders. So we believe in empowering the parents. They obviously want the government to force and to use coercion. Our policy, based on the Parents' Bill of Rights, is this is the parents' decision under Florida law at this point. Now this is a new law that was just signed. It wasn't necessarily in effect last year. So we're in a situation now where we believe that the parents' rights will be vindicated, and we'll work to make sure that that happens in any way we can. But the idea that the federal government would get involved in that, I think obviously would be very inappropriate.
Governor,
yes.
Welcome again.
Yep.
Pensacola, good to see you. Here's a line from your executive order. Studies have shown that children are at a low risk of contracting a serious illness due to COVID-19 and do not play a significant role in the spread of the virus. But here in Northwest Florida, Governor, right now there are children in area hospitals who have COVID. We have confirmed it. We know some of those kids right now are on ventilators. So given that, what can you say to parents as school starts this week here about keeping kids safe from COVID?
Well, everything in that is 100% true. They are at low risk. If you look at the whole pandemic, however many people were hospitalized in the state of Florida at any given time, between 1.1 and 1.4% of that were children. So the overwhelming majority, 98+%. Right now, it's 1.3% of all the hospitalizations. Now, what I would also say is we've had a wave of RSV throughout the country. That is putting more kids in the hospital than COVID. That's a very significant risk, much more riskier than COVID. I would also say, based on surveys of hospitals, between 25 and 40% of all COVID-positive pediatric patients are incidentally positive. In other words, they're being treated for something other than COVID, and they're in and happen to test positive because they test everyone that goes through. So there's not been any change in how this impacts kids. It doesn't mean that theoretically it can't. And I think if you look throughout the country, if you look at the under 18 kids who have died with COVID, the vast majority of those had really, really significant health issues. You have people that have leukemia, you have people that have really sad things, and it's a tragic situation. But the notion, and we went through this last year with the schools. When we pushed to open schools, people said that this was going to be something that was going to be very problematic for kids. It turned out that was not the case. And actually, the schools, they're less likely to get it in school, believe it or not, than at home. And the reason is because what that statement said is also verified. You have very few instances of a student infecting an adult. It's almost always the adult infecting the minor. And that's been true throughout the whole pandemic. We haven't really seen any changes to that. And so, I would tell parents, I mean, obviously, you know your kids. That's the whole thing with the parents making the choice on the masks. And so I think each one's going to be different in terms of how they look at stuff. But I can tell you, we've not seen any material change in how this works. Now, obviously, we have more people hospitalized today that are COVID positive than we did 6 weeks ago. I mean, we're in the midst of a wave. And so you're going to see more of every age group, but the percentage of minors has not increased with Delta or with this thing. And I think that's interesting because if you think about it, we have 80% of 50 and over that are vaccinated in Florida. And that's the group that has the highest percentage of hospitalizations typically. So you would think that potentially the kids would make up more of a percentage because they're obviously not eligible for the vaccine, but they're still about 1.3%. And here's something else. An unvaccinated kindergartner is at less risk for COVID than a vaccinated 30-year-old staff member. And that's been true in the data. Now, the 30-year-old staff member is low risk and for serious illness as well once they're vaccinated. So I think that we had a great school year. I think we'll do it again. This wave last summer, we peaked earlier in July. Now we're into August, and so it's running up more in the school year. But at the same time, I mean, I think that kids have been out doing a bunch of stuff the whole time anyways. And so I think it is not a kid's disease, fortunately. It doesn't mean you can't find one example. But I would say in almost all of those examples, there's usually other aggravating factors that are present. And certainly for pediatrics, I think the RSV wave has been much more threatening to minors than the COVID has.
Governor, the CDC have reported more than 28,000 new COVID cases on Sunday, but the Florida Department of Health reports there were 15,000. Can you, Governor, possibly speak to the disparity?
Yeah, it's an easy mistake. Yeah, so what happens is CDC doesn't report on the weekends. So the state of Florida provided 3 days worth of test results to them on Monday, and that's for Friday, Saturday, and Sunday. So those would have been reported Saturday, Sunday, Monday. And the CDC, instead of what they normally do, is they just take the total, divide it by 3, and put it in. Instead of dividing by 3, they just put it under 2 days. And so technically, they have 0 cases in Florida for Monday, and then they had whatever they did for Saturday, Sunday. So they should have put it out over 3 days. They put it out over 2. I know the Department of Health has reached out to them. I don't know if they've corrected it since then, but that's all it was. It was just the way they're reporting it. They didn't do it over the 3 days when that was 3 days worth of test results.
Governor, are your health professionals telling you that your health advisors, whoever they might be, obviously from the state, that this surge is going to end, or at least the numbers are going to decrease in the next month?
No, I think for sure. I mean, if you look, so we have a big state, as you know. So the wave didn't start at the same time throughout the whole state. So for example, the wave started in Northeast Florida. Their indicators in terms of their RT value is now below 1. They have a decline, 7-day average decline of 18% in cases. And they have a decline in COVID, ED visits for COVID-like illnesses. You have the Panhandle, you didn't necessarily start increasing the same time, but it's a similar cycle. And I think most people think that you're going to see not just Florida, but you'll see the Sun Belt throughout, because it's not just Florida. I mean, if you watch certain news channels, you think Florida was the only state that had any type. But I mean, you look at some of these other Sun Belt states, deep south, and I think you're going to see it. I think you'll see it roll over for sure. When they do these waves, it's a very repeatable pattern. And Michael Levitt, as a professor at Stanford Medical, he identified this pattern like a year and a half ago. When you start to see these increases, they go and then they accelerate, and then you'll have the growth will slow, and then it'll kind of go into a holding pattern, a plateau, and then it starts to recede. Now, the one thing we saw with Great Britain was they had a huge upswing and then a huge downswing very rapidly with Delta. And the question is that unique to Great Britain, or is that how Delta, there was a huge downswing in India too, because Delta came from India. So we're looking at that, and hopefully we see it recede very quickly. I would note, because there's some people who say, oh, well, shut down, do all that, which we're not doing. Great Britain, they did their Freedom Day like right when they hit the peak over the summer, and it just fell off a cliff ever since they got rid of all of those things. And so I think it shows that these things have a very powerful life cycle, and we're seeing the indicators. And I think you will see, not just in Florida, I think all the states that have had the increases. And then what's going to happen is, and this will blow up narratives, but as the seasons change, you're going to start to see these patterns emerge in the Midwest and in the Northeast. And I think it'll be very repeatable, and I think it'll be very similar to what we saw last year, maybe even with some of these cases, because Delta, it's an aerosolized virus, it's very transmissible, and it's not something like the things like social distancing. I mean, it doesn't matter because it's just in the air. And so I think you're going to see that, but I think you'll see similar patterns. What we have seen in Florida in terms of the hospital census, if you talk to pretty much every single hospital executive I've spoke to, chief medical officers, they will tell you that the senior population that's heavily vaccinated is not showing up in the hospitals like they did last summer, because the vaccine has reduced their chance to be seriously ill. So you don't have massive numbers of nursing home residents. You don't have a lot of 70-year-olds. I mean, you have some because there's other ailments that happen and you can still be positive, but that's not driving it. And so that's an indication that focusing on those vulnerable people has worked in terms of reducing severity. But and what they typically see is the folks who end up hospitalized, and particularly those who end up going to intensive care, tend to be people, who either haven't had immunity from a prior infection or have not had any vaccination. What I would tell folks, and a lot of people don't know about this, which I think is kind of should have been, everyone should know this. If you do get infected, particularly if you're higher risk, they have monoclonal antibody treatments that if you get it, it's an IV treatment. If you get it early, the chance of you being hospitalized is very, very small. And it's worked very well throughout the state. The only issue's been is not everybody knows about it. And what happens is you're somebody that's higher risk and you get infected and you don't necessarily feel that bad. The incentive is kind of like, well, you know what? I think I'm going to be fine. What happens, though, is that once the virus progresses and it becomes more serious, the monoclonal antibody at that point is not likely to reverse it. If you get it early, I mean, it really nukes it. People's symptoms are resolved relatively quickly. It's kind of the closest thing we have to a cure. You just have to do it at the very beginning of the infection cycle. And so that's what we're trying to tell people is, okay, if you get infected, talk to your doctor immediately and ask about whether the monoclonal antibody treatment, it's one of them is Regeneron, which President Trump used when he that was still under experimental use then. He used it, and he's told me personally that totally cleared everything up. You got to go by data, and the data's strong on this, and so anecdotes you got to take with a grain of salt. But it is striking to me, 100% of the people that I know that have gotten monoclonal antibodies have said that it completely resolved their COVID infection within 48 hours. So that's the message for folks. I mean, obviously, we have now in Florida, we have over 80% of the 50-plus population that's been vaccinated. That has helped reduce illness. Now, it doesn't do what we hope in terms of creating herd immunity. People are still testing positive who are vaccinated. It's usually a very mild case. They're not being hospitalized in large numbers, but it's not necessarily preventing the spread like we hoped that would do. And people are looking at that. I've talked to folks, places like Stanford and Harvard, and they said that they think that the monoclonal or the vaccines probably do reduce your likelihood of being infected and spreading it for about 3 months pretty dramatically. But then after that, it's a little easier for you to catch it. And that, again, these are not serious cases. But if you're counting cases, and if that's what people are fixated on, just know that you will continue to see cases even as the vaccinations go. I think it's also important to point out, there's a narrative saying that somehow that increased cases are tied to how high the vaccination rates are. Florida, we have the highest vaccination rate in the Southeast. We're 22 out of 51. So it's not like we're a little bit above average nationwide. And then with seniors and 50 plus, we've got over 80% of 50 plus. You have places like Israel that are the most vaccinated country. It's one of the most vaccinated countries in the world. They're having huge surges right now, probably similar on a per capita basis to what Florida has seen over the last couple of weeks. You look at some areas like Iceland, it's like almost 90% vaccinated. They're having huge increases. And so the cases and kind of some of these spikes, the vaccinations are not necessarily preventing that. Now, I do think they're helping to prevent serious illness, but people just need to know that that's kind of what the use of them is for. And if people, if they have a belief that, well, if more people got vaccinated, then COVID would go away. That is, I think at this point, we know that that will not happen. I mean, it will continue to circulate, and even people like me who are vaccinated, you know, I'm going to come in, I probably have come in contact with it, but I mean, I've never tested positive, but if I come in contact with it, you know, I potentially could get a very mild infection, and then that helps build the immunity. But that's the way this is going to play out. It's not going to play out. I know some of these folks in DC have said, you know, once we have, I think people in that are on TV all the time said, once we have 50% vaccinated, COVID will just go away. That's obviously not true, because we have 50% nationally vaccinated, and we still see. So that's just what we're dealing with. But you know, at the end of the day, I think we have the tools between the vaccinations and the monoclonal antibodies to be able to take COVID from something that was, you know, certainly more risky for elderly people in particular than the typical respiratory virus, and take that and really make it a flu level risk for most people. And that's kind of the direction that we're going. Okay, well, I gotta run and get back to Tallahassee, but thank you all for coming, and we really appreciate everything that the Escambia County Sheriff's Department and everyone here does for us. Thank you.
How you doing? See you. All right. Yeah.